have an update. I tried to film it a couple times. For some reason it wouldn't upload yesterday. I don't know if a lot of people were just uploading it once or what happened, but I do have a lot of bad news, unfortunately. Also just been trying to just deal with it, me and my husband and my family. So I went for my 6-week ultrasound on Wednesday, the 15th, and I could tell in the lady's face something was wrong. And I was like, well, what's wrong? She's like, well, I know you're professional, so I'm just going to tell you so you're not shocked when he walks in here. Unfortunately, I had an ectopic pregnancy. And the first thing that crossed my mind, how's that possible? When your tubes are blocked. And that's the whole reason you're doing IVF and everything else. Now, I did know in the back of my mind that on the left, she didn't tell me what side it was. I could have swore she told me the right side, and I was like, there's no way that that's possible because the right side's completely blocked. But it was on the left side. I could have swore she said the right side, but when Dr. Satnauer looked the next day, it was on the left. So, on the left side distally from the ovary, which means farther down, towards the end, they base off of where your ovary sits. Your ovary sits up here, and then your tube comes down into your uterus. So further away means distal. So my distal part of my fallopian tube was open, which I knew this because I knew it from my scan that I had. And it was probably like more than halfway blocked down. So it was right towards the end where it was open. I was a little concerned about it with IVF, but I mean, my doctor wasn't concerned, so I wasn't really concerned, you know. So my first HCG was a little bit on the lower side, so she was a little concerned, but then my second one's fine. I mean, it wasn't as high as she would like it to be, but I mean, it was doubling and it was growing just like it was supposed to. And everybody's number's a little different. So she's like, Ashley, that's a lot better. I'm happy, you know, blah, blah, blah. We'll do, you know, your ultrasound and we'll just see how everything goes. We'll see how everybody's numbers is not going to be the same. Such a big difference. It varies so much in between patients. So this was at my regular OB doctor's office. I was high risk, so they wanted to see me earlier, which I wanted to give them the option to do for that. So that's how I found it out. I will say this physician that come in to talk to me about my ultrasound was one of the rudest men I've ever seen in my life. I don't care if someone does IVF. I don't care if someone gets pregnant naturally. If this is their 4th, 5th, first child, you don't go in with an attitude from the get-go. And then I know they were extremely busy. They were behind. They had extra cases that day. But that doesn't mean that you don't take the time and try to sit with me and explain to me and answer my questions. And not just try to shove methotrexate abortion pill down my throat. So, and then because I said, well, how can this happen? And he's like, well, you know, I said, I know the sperm and the egg meet in the fallopian tubes. I'm not an idiot. I said, I did IVF. I saw her put them in my uterus, in the middle of my uterus. I watched it on an ultrasound. He's like, oh, you did IVF. Well, did you read anything in my damn chart before you even come in here? That's what I wanted to say, but I didn't. And the more I questioned him, the worse, the more of an attitude that he got. Not like outright, like, but I could tell his demeanor was changing. For one, I question physicians all day long, so me questioning you about your opinion does not hurt my feelings at all, and it shouldn't hurt yours. You should want a well-educated patient. And then I said, well, he's like, well, when they inject them, they can slide up. I said, okay. I said, but my first question was, my tubes are blocked. How is that possible? That's what I was trying to get through my head and try to process at that moment. You know, all of these things are happening at once. I'm losing my child I've worked so hard to get, that's healthy and growing, and his heart's beating, and, you know, he's measuring perfect, and now I have the news that I have to kill him. I just, and I'm one of the worst haters of abortion in the first place. So it was a lot for me to process at once. So anybody that talked to me, it wasn't going to be, in a pleasant experience regardless, but he didn't have to be as rude. When my husband is sitting over in the corner and he realizes he's rude, because Robert, he pays attention, like he knows what's going on, but he doesn't, he lets me handle things a lot most of the time. So he was like, well, I said, no, what do we have to do? What happens next? He said, either we can, I said, do you have to go in and take them out? He said, that, or either you can take methotrexate. I said, well, I'm not doing that. I said, and two, I'm not doing anything else until I talk to Dr. Stattenauer. That's what he said. I said, well, I'm not doing anything until I talk to her. So I said, now I have an appointment with her next week. Should I wait that long or should I get there sooner? Well, you need to go see her sooner. You need to see her tomorrow. I understand. He said, you could die from this. I get that. I completely get my tubes can rupture and I can bleed to death. I get it completely. So I said, well, if you could call her, that would be nice. And I'm going to try and get in touch with her and get an appointment for her. He said, now, you can't, you have to go to the ED if you have any other problems. So, that's what happened with that. And my poor husband didn't know what methotrexate was. He was like, he wanted to say, hold up, Ashley, let's see if it's something that can help the baby. I said, baby, that was going to burn our baby alive. That was going to kill it. It's not going to save it. There's nothing we can do. He didn't want to believe it. And he's like, Ashley, just don't worry about it till tomorrow. They probably don't even know what they're seeing on the monitor. Of course, he tried to help me, So I made an appointment for the next day, which was at 10:30. We went for the appointment. Unfortunately, it was the same thing. But they said it was higher up in my ovary, which I know was bullshit, because they just didn't know what they were. I don't know if they halfway knew what they were looking at or not. I guess you don't see ectopic pregnancies all the time. So she said it was down right at the end of the tube. Here's the tube at the end, and where the uterus meets, it sits right there. His little heart was beating. I don't know if it was in he or she. That's just my feeling. That was a boy. And I was like, well, can the baby grow down from the tube into the thing? She said, Ash, as soon as the placenta and stuff gets bigger, it's going to rupture your tube, So we took pictures. She cried with me. When she saw the baby's heartbeat, she just teared up and cried with me. She said, it's so perfect. I was like, I know. She said, it's a beautiful, beautiful pregnancy. And, she just cried and cried and cried with me. So that day, she's like, well, you're stable. You're not showing any signs that, your tube's about to rupture or anything. Your vitals are fine. Which, of course, my pressure was up, but it was just because I was worried about the baby. So well, that didn't help. I'm trying to get the sun out my face. So basically that day we scheduled an appointment for the following day, which was Friday, to have surgery is what I chose to do. One, if I took the methotrexate, one, I'd be burning my baby alive, basically. Two, I couldn't try to have another transfer for 3 months. And at 6 weeks, your brain is there, your spinal cord there, your spinal column. Of course, it's not completely developed by no means, but it's there. Your heart's beating, blood vessels pumping, blood's pumping through your little baby's body. So who can say that they can't feel? That's my thing. So I would not want my baby to sit there and burn alive, no matter how little they are. So I said, well, I don't want to take methotrexate for one at all. I don't want to take a chemo agent regardless, because you don't know what it will do to your body. So I told her I'd rather her go in and take the pregnancy out from the tube, and then she could look at my tubes and just most likely just take them out because they weren't any good anyway. So she's like, well, actually that's an option, and that's perfectly fine. She's just a lot more invasive than you taking it. And she said it'd probably be better because then I can look and I can clean out your tubes if I want to clean it out, or just take it out. I suggested her just to take them out because I didn't want it to happen again, and they were damaged and scarred and all that anyway. So what was the purpose of keeping them? So I had surgery on Friday. I went back at 1:15. I didn't wake up in the PACU until 5:30. She came back there and was like, it was a disaster in there. I got technical because she's so honest with me, because I'm a nurse. So she, I'm gonna tell you, I thought I could go back to work. I had to go to work Saturday night. I thought I was gonna be able to go to work and work all weekend. Oh boy, was I wrong. She said she was going to use 3 trochanters. That's the tool to not have to cut your belly open, but the laparoscopic surgery. But she only used 1. And I told her, because she come back to see me in the PACU, I was like, my stomach hurts so bad over here. I couldn't move. Nothing. She said, well, actually, I only used 1 tool because I didn't want to scar your belly up, so you're going to have more pain than you normally would. What the freak is what I wanted to say, but I was like, okay. I couldn't get out of the bed. The nurses had to pull me up. They had to get me out of the bed. I could walk to the bathroom, but not without holding my stomach. And like the gas that they use to blow your stomach up to do the surgery, I think that made it even more painful than it normally would be from them digging around. I'm not a little girl, but it like blew my stomach up, and it would make it like, it made it in like weird shapes looking, and that was so sore and painful. Like I couldn't even sit on the toilet to pee. Like I had to sit there and kind of like barely squat the first night, and then I couldn't. It took me forever to wake up. For whatever reason, I couldn't get my oxygen to stay up, my oxygen levels. I'd fall back to sleep and then drop to like 87. It took me forever to get out the PACU. My family was starting to get worried. I was getting worried about myself. I'm like, why? And if I keep looking at it, the worse it got. I was like, geez Louise. So it took me a little longer to wake up. I did have some nausea, which I didn't from the first time I had anesthesia, but I just told her to stop giving me pain medicine because I was ready to go home, and I wanted to get to the regular, to like where they watch you for a few more minutes before you put your clothes and stuff on. I wanted to get out there. I said, can my family just come back here? Because if they can talk to me, I'll stay awake and I can stay up, But she's like, no, they can't come back here. You have to make it to the other side first. I'm like, ugh. So I did that. Finally made it over there. I didn't get over there like 6:30. And then she watched me for a few more minutes, and then my grandmother and all them come back there, and that was nice to have them back there. And then like 30 minutes after sitting there, she let me get up and go pee, put my clothes on. That was like the worst experience of my life. And then I went to the bathroom. It was disgusting in there. I was like one of the last patients of the day. It was horrible. I did not want to get dressed in there. I was scared I was going to catch an infection. I've been to Centerra. I used to work there. I don't know what happened to that bathroom during the day, but somebody didn't clean that bathroom. But everywhere else was clean. It was just, I've never been in that part of the hospital either, so. But everywhere else is clean there. Please don't think Centerra's not clean, because it is. I think it was just the end of the day, and the bathroom needed to be clean. That's all it was. That was all. People just don't clean up behind, don't keep themselves neat. That's all. And that's the last thing. When you wake up from surgery, that's the last thing that you want to see is paper towels and shit everywhere, and it just isn't neat. You think a hospital bathroom should be neat at all times, and there's no way you can keep it neat all the time. But because people are gross. But whatever. So anyways, I'm going back to work actually today, which is Tuesday. My doctor made me stay out. Of course, Friday I already had off, but Saturday, Sunday, Monday, 3 days. So I'm going back to work tonight. I haven't taken any pain medicine since last night, which is okay. My stomach is a little sore today, but it's like a million times better compared to what it's been. It's just a little sore because even yesterday I would take pain medicine like every 8 hours instead of every 4 hours, and it would just keep it, the sore, like the residual effects down. Now it's just a teeny sore, nothing crazy, but enough for me to be able to go back to work, and I'm fine. I will say I had no choice in taking the ectopic pregnancy out. There was no choice in it. I had to do it. I can't just kill myself letting the baby explode. It's going to kill the baby and kill me regardless. It breaks my heart. I've cried all weekend. I don't know how to explain how you feel. You just feel empty. I only had him in there for 6.5 weeks, but I've loved him from the time that I thought about doing IVF. Well, all of my babies. I've loved them from the time they were growing in my follicles. I wish things could be different. It's just like it feels like a torture. Like God says, "Here, Ashley, here's your baby. I give you your heart's desire," and then it just gets ripped away. I'm so tired of crying. I think my tear ducts are dry. I just don't know how to explain it. I have the best family ever. My grandmother and my family has been absolutely wonderful to me during this time. My husband has been so good to me. I've cried and cried, and he's like, "Baby, it's so early." I know, but you don't have the attachment to our child that I have. Of course you love him already because I was pregnant with your child, but you didn't carry him and see his heartbeat and know that you're carrying your baby, and just I think it would be easier to have it done if the heartbeat had stopped and you just have to do a D&C and take it out. But to have him and see him growing and see his little heart beating so hard and fast and just so strong, it just kills me. And I was like, and I told Dr. Sandra, there's no way I could take that pill. I said, mentally, I cannot do it. I said, I know because the blood's flowing from the placenta and it's getting a little oxygen and stuff, I know if I get that anesthesia, it's not going to feel anything when you go to cut it out. It's not. And, the anesthesia is sure strong and it'll probably kill it, unfortunately, but it won't hurt. There's no doubt in my mind that the baby didn't feel a thing. So that's what gave me confidence that my baby didn't have to feel any pain. So I had to die. work. But I thought about getting a tattoo, and then I thought about just getting some jewelry, a necklace. I really like the little saying that I found on the internet. I carried you every second of your life, and I'll love you for every second of mine. I really like that saying. So I found a necklace that has it, and it has a little bead thing that goes with it. And you can either choose the color of the birthday, the month that they're supposed to be born, or whatever the case. I did give him a name. Once I found all this out, I was thinking, like, between week 5 and 6, like, what kind of nickname can I give my baby? And the week 6, according to the Little Baby app, they are the size of a sweet pea. So I gave him the nickname of Sweet Pea. So he is my little sweet pea, and will always be my sweet pea. So I just truly, the Lord has given me the peace that I need, and I prayed the other day that I would see his face, and that I could hear his voice just one time. That's all I wanted to see. And I heard his voice when I went to sleep, and it was like I was looking around to hear, because I could hear it. I knew it was him. And my husband come upstairs to check on me because he didn't know why I was upstairs. I was asleep. His friend came over, so I just went upstairs to take a nap and just like give them a little time to themselves, let them play Madden and all that, and just give them a little men time, And I was tired anyway, so let me go take this stupid road. It'll be a good time for me to go take a nap. So, and then he woke me up right before I could go see his face. I was like, yes, I'm fine, honey. Thank you. I love you too. He's just checking on me. I wasn't mad. I was just upset that I couldn't see his face. So I prayed after that, and prayed that I could see my baby's face. And when I was going down the road, coming back from dinner, it's not like my vision stopped. I could still see, but all I could see was his face. I had the vision right over there in my seat, and it just took my breath away. He was absolutely, that's when I knew he was a boy too. But I had that feeling from after I found out about the topic pregnancy. I had a feeling that he was a boy from then on. And then I saw his little face, and he was absolutely gorgeous and perfect. I've never seen a baby so beautiful. Like, I know people say their babies are beautiful, but I'm serious. Like, it was gorgeous. He was just gorgeous. My adopted son has beautiful black, jet black, curly hair, but it's not so tight curly. This son of mine, his hair was the jettest black I've ever seen in my life, and it was more tighter ringlet curls, like what my husband has when he gets out the shower. My husband has he's a black man, but he has beautiful hair. It still gets the afro looking tight, but when he gets wet and he washes and puts conditioner in it, it's like these ringlet curls. And then as it dries, it gets coarser. But my son's hair wasn't as coarse as my husband's was, but you could tell it looked like his when he got out of the shower. He had the head full of his hair. Head full of hair, perfect nose and mouth, and his eyes. Like, I have beautiful eyes, and I can really dazzle them up, but eyes were just piercing, and they were like dark black blue eyes, and he had olive skin. I could just see his face, is all I could see, and that was the biggest comfort to me, for sure. Anyways, I think that's all I've got to say for today. I've been rambling on for 25 minutes already, and I don't know how I do it every time. I try to just do like 10-12 minutes because sometimes it gets so long and drawn out, you know, people go on rambling on like I do. Anyways, I'll be praying for all of you guys, and I appreciate all the prayers that you guys can give me, and I still pray that you guys get your babies soon. Hopefully we can do another transfer soon. I'm not trying to rush things, but I know this is a horrible way to say it, but I've already paid. I've met all my deductibles and stuff this year. I'd like to go ahead and get pregnant and have a baby by December, so I don't have to pay nothing. And it's a horrible thing to say, but it's so true, because when you spend so much money with infertility stuff, I mean, there's something to consider. But of course I want to be pregnant anyways. I mean, but as soon as Dr. Stettenauer says my ovaries, not my ovaries, but my uterus and everything looks good and is ready to go, our plan is to go ahead and try again. He wasn't in my uterus. Now, I did have surgery and she didn't mess around in there. So she said maybe a month. So April, like after my period in April, we can do it. So we'll see. And of course I'll bring you along with that too. Just please pray for me, and I'll talk to you guys later. Bye.